Right now.
innovations and things. Okay, lovely. Yes. So where do we start from?
Yeah, tell us about yourself. Let's start with introduction. I want to get to know you. I want to get to know you also. I want to know you.
Okay.
So, can
Uh,
you please introduce yourself?
before I start, I would like to say thank you. Thank you for having me on your YouTube page. I must say that you're doing an incredible job with what you're sharing for, trying to help people. It is so great. I know that as you might have seen in the UK, that it can get really busy with everything, and taking the time out to try and support people. It is an incredible thing. So well done to you. Um,
Yay.
so my name is Olayinka. My name is Olayinka Thomas Arugundade. I am a mother. I am also a wife to one. Um, I'm a mother of two. I've got two girls, Motilola and Moyolua. So I've got background in health and social care. I've been working in health and social care now for 2 years. I started my own career whilst I was in college. I started as a carer myself. So I've
Yeah.
sort of done the front line bit, and I've been a care coordinator, and also right now I'm a CQC registered manager. I'm also a consultant and a trainer. And I have been, I've had a lot of experiences on the front line and also within the management as well. And that's what led me to start Black Women in Care. And
No.
with Black Women in Care was established by the end of 2019. We started in 2019 trying to bring people together, especially people that are working within health and social care, because I don't, the first thing is coming to this country. The other thing that you get when you come into this country is you find out that there can be racism, there can be
Yeah.
discrimination on people, Black people, especially that working within that social care. And there are a lot of us working within that social care, especially on the front line. And what I realize is that majority of us are not actually on the leadership line. Haven't sat
Wow.
down with leaders myself. There are very few of us in the boardroom, and that's what I started this Black Women in Care to support, to empower us. Black people that work within health and social care to empower one another, to support one another. We train ourselves. We have meetings. People come to share their stories, and we support one another. It's like that you have a backbone, someone you can lean on, and we
Yeah.
have people that have businesses as well, and they might be having issues with their businesses, and we do support with that. So yeah, it's been a quite journey with Black Women in Care and with myself. So yeah, that's about me. I'm gonna put a pause to that for now. Thank you.
That was amazing. That was awesome. Like to be honest, the UK can be racist sometimes, and it's subtle racism. It's not like someone is going to tell you to your face, like, but this they are being, and the fact that you created this platform and an organization where you will support people. So when they come to the UK, they won't feel lonely, because this UK can be really lonely. To be honest, it's a very lonely country. The first 3 months I moved to the UK, I can remember crying. I'm like, I want to go back to Nigeria. Like, this country, they are
Yeah.
so cold. I'm like, nobody
Mhm.
even cares. Unlike Nigeria, where we have this, your neighbors can be you can be so close to your neighbor, and you have this rapport with your neighbor. In the UK, you can't even be like, please, I need to rush to the market. Can you watch my baby? I'll be back. Nobody can do that for you. And working in an environment where it's mostly you don't have anyone to talk to, or
Mm.
like this, what you're doing is amazing. Creating a platform for Black women in the UK in care, a place where they can come, like open up and be like, this is happening. What can I do? And I'm sure you guys provide solutions to people's problems and encourage them mentally, emotionally, because the country can be mentally, like, can be depressing. To be
Yeah,
honest, I would say you
it can be mentally draining. So we provide emotional support, mental support, and also we're starting our financial support. Actually, we're starting our grant this year, by God's grace. Supporting people, because
that's
you,
amazing.
you mentioned something very very important there, especially with childcare, for example. we see that a lot of black women that are working, at the end of the day, they're working to pay for childcare, they're working to pay for bills. At the end of the month, there is nothing
Exactly.
left. So we're starting with our grant, and by the grace of God, this year, before the end of this year, to try and support people financially. We said, we can't say much, we can train, we can do so many things, but sometimes what people actually need is finances, and
Yeah.
every little thing counts. Every little thing, when I came to this country, I remember my uncle saying to my mom, "Have you taken Inka to where you pick money from the tree? Have you ever seen money on the floor in this country? You can never find money on the ground. You've got to work hard for it." So every little thing counts, and that's what we're starting with that before the end of this year.
That's amazing. Like you're doing a great job. Oh my goodness. I'm not in care, but can I join? Like,
You
can you
honestly,
start
you're
another
You're welcome to join us. You're welcome to join in care. I can honestly now I can't think of any career that I would rather do. Initially, I will tell you. Initially, when I joined care, I wanted to leave. I didn't really like it. Because my how I started, because I took care of my grandmother back in Nigeria. I took care of her, and I would go to appointment, which is something that I did when I started. So I do have passion for elderly people, but the job itself, the professionalism when it comes to the responsibility, especially with the company policies and everything, I didn't really like it at first. But then again, when I saw the prospect in it, and people that actually realize that there are lots of opportunities within health and social care. It's not just about being a carer. There are over 350 jobs within health and social care alone. If you go on NHS website, you find it that there are over 350 jobs within NHS. So there are lots of opportunities within health and social care, and that's one thing that we
Yeah,
aim to educate people on as well.
I heard that in the UK they have a lot of care homes and um a lot, like a whole lot. So that's why they sort of started this visa for to attract overseas carers to the UK, which is amazing. When I moved to the UK, the first job I got was a care job. I didn't start the job at all because when I was applying for the job, because where I was staying there was in Southeast London, so there was a name, the name of the street. I thought it was my street. I was so happy that I'm going to be working to now to work. I didn't know it's in North London. And when I contacted the manager, that I just realized that this place is 2 hours away from where I live. I can't cope. I won't be able to be going to work, coming back every day. It's going to be costing me a lot. And the manager never responded to me till date. That was why I didn't do the job. And I said I'm glad that he didn't respond because I don't know whether I would have been able to do the job. So it's good to have you here. So what would you say, like the care industry in the UK? What do you have to say about it? How do you think it's like? Because a lot of people back home in Nigeria or Africa, South Africa, wherever it is you're watching from, they don't have an idea of how the UK health system works or what the UK are looking for. So most times when they apply for these jobs, they don't get it. Not because they can't do it, it's because I don't know. I feel they don't understand the UK standard. That's what I'll say. What do you have to say?
Um, can you still see me?
Yeah, I can see you. Can you
Okay.
see me?
Yes, I can. I can. So there are a lot of opportunities within health and social care, but like you mentioned, UK has standards, and what I did tell people is that there are opportunities, but also they need there are certain standards that they are looking for, and it's not just about the qualifications that you have. They want to see that you have the experience. As you might have seen, they want to see that how many years experience do you have in a certain role, and before they can actually give you that role. And also, you have to bear in mind that as you are applying, other people are applying as well.
Mine as well. Exactly.
Because the first time I mentioned this tier 2 visa within health and social care, it has been since last. As a matter of fact, it's been for a long time. It has been for a long time. People could apply for tier 2 visa a long time. I remember my previous employer, they had that sponsorship license. But the only thing is it wasn't for a senior care worker. They had sponsorship license for their office staff. But this health and social care started during the COVID time, and there are lots of staffs. Some staffs were self-isolating because they had COVID. Some, and especially also last year, they have to get vaccinated before you can work within health and social care. So you have to bear in mind that for every job vacancy that you see online, there are thousands of, as a matter of fact, there are even millions of people that are applying for that same role. I watched one of your video, Faith, and you mentioned something very significant there. You said something about being patient. And I see, as a Nigerian, it's not something that we do so often. We're not
We,
very patient. We
we
like
don't
to,
have
find the job today, start today, come to the UK today. But with the UK, it has to go through a process.
process.
There is
Yeah,
a step-by-step process that you have to go through. And with that, you need patience. Because if you're impatient, you're going to fall into the wrong hands, and people are going to be asked, demanding for so much from you, such as bring money. We're going to help you to fast track it. And at the end of the day, it is not true.
yeah, it's not
You
true.
have to be patient. You have to be patient. So, like I said, UK has standards for every job you're applying for. Other people are applying for it. But now you have to show what makes you different, what distinguishes you from the other person. Why should the employer give you the sponsorship license and not the other person? You
Exactly.
have to distinguish one, your skills. Pick areas. For example, there are some skills that they're looking for within health and social care, and caring obviously is one. Caring is
Yeah.
one. For example, you have to show that you're caring. You have to show that you are reliable. So probably putting it as one, maybe you have to show as being reliable. You can find an example during this might come maybe during your interview stage, but if you can find a way to incorporate that into your CV, you have to show that you're reliable. You have to show that you have empathy. You have compassion. Maybe putting it that on the, at the on the your is it what they call it? For business people, they call it pitch notes. But you can put that at the top of your CV. You're a compassionate person. You like to you're reliable, and based on the feedback that you've had, and your reliability also. How they will find out is the place that you've worked. If you're the kind of
Yeah.
person that you're jumping from one job to the other, you've not actually spent so much time. Maybe you're working with someone for less than 3 months. That is a flag for them, and they'll be like, oh, this person, we have to be careful, because this person might come and then leave us at the end of 3 months. So you have to show that you are reliable, and your work experiences will be able to identify that. So you have to
Okay.
distinguish yourself. Yeah, you wanted to say something?
Yeah, no. I said okay. So once you're done, we'll go through some people's questions so that we keep them engaged and involved in our conversation.
Sure.
So someone said, "I love your BWIC hoodie." Yeah, one
Okay.
said that. So somebody is asking your social media handle. So I don't know if you want to say sharp quickly on Instagram, your social media handle.
My social media, and so you can follow Black Women in Care.
So it's at Black Women in Care.
Yes, all
Okay.
one word. All
All
one
one.
word. Black Women in Care.
Okay. So let me put it here. Is at Black Women
In Care.
in Care. Okay. Okay, so someone also asked, how can I get certificates in care?
How
That's
can you
RA.
get certificate in care? Um, I'm just looking at some of the questions. Someone said that, do you offer sponsorship to carers in Nigeria? So how can you get certificates in care? One, you can go online. You can go online, search for online courses. But some of these online courses, what happen is, for example, for a care certificate, you need to be working somewhere for you to get the care certificate, right?
Oh, really?
So if you work, yeah, you need to be, because that certificate is 15 standards. So we're talking about carers here, not any other job. So the care certificate is 15 standards: understanding your role, personal development, medication. Medication is not part of it. You also have safeguarding there. You have privacy and dignity. There are 15 standards altogether. Infection control, part of that 15 standards, it needs to be signed off by a senior person,
Oh,
and
wow.
it cannot be that's what that's because the care certificate, it takes about 3 months to get it, but people can do it within 2 days. You can finish it online within 2 days. As a matter of fact, less than 24 hours you can, but it need to be signed off by a senior person, a senior colleague. So you need to be working somewhere at the moment where the senior colleague can sign you off as being competent to carry out the role.
Oh, okay. I see. But those are for people in the UK, right? Or anywhere, wherever you are, doesn't matter. You have to be working.
It is a UK certificate. So
It's
if
like,
you're offering the care certificate anywhere in the world, you still have to go through the same process.
oh,
Some,
really?
don't get me wrong, some people still say that you can get it somehow. I don't know how to do it, but the standard by CQC and Skills for Care is that it needs to be signed off by a senior person. And there are other short courses that you can do that is not a care certificate. There are other care courses that you can do that is not care certificate. But the care certificate, 15 standard altogether, but you need a place like a clinic in Nigeria, or I don't know, there are not many care homes in Nigeria that you can use, but most especially you can use like small little clinics in the neighborhood community. And then you can,
Yeah.
and also you can volunteer. That's another thing I wanted to mention. That add on your CV, volunteer with people. We go to clinics and volunteer for 2 months, 3 months. We'll add that on your CV. That would give you an edge with other people that are applying.
Exactly. I've been saying this. I even told them to join the Red Cross. There's Red Cross everywhere. Red Cross trains you on first aid, accident training. They do a lot of training for you, which counts because it's a Red Cross is known globally.
It
So
is.
yeah.
First aid that
So
you mentioned is one of the
yeah,
mandatory course in health in social care. So first aid is a mandatory course, and if you go to through Red Cross, is a well-known name, and you are able to get that certificate, that would give you an edge. Yeah,
yeah, yeah,
yeah.
a lot. So someone asks, does a dental technician stand a chance to get a care job in the UK? Buki, Adele,
A,
Buki.
a dental technician, yeah, you do because you're already within health and social care. You do, and obviously that will also give you an edge because you're a dental technician. I don't know how many years experience that you have, but yes, you do. But as you know, that Faith might know now, the only clause there is that they might say that you are too overqualified.
Yeah, I
When they
keep
say
saying
that,
I don't know why Nigerians. I've seen someone saying, I'm a doctor in Nigeria. Can I apply for the health? And they're like, why do you want to apply for health and care? Why not apply to be a doctor in the UK? Go through the
yeah,
whole exams, go through, I don't know what the exams they write because I'm not, funny enough, I have so much information on the health and care and I'm not in that industry. I don't, that most of them who are already in the industry, they're coming to ask me question. I'm like, you're in this field, you should have known all of this. I've never done anything relating to health and care in my life before. And I talk about it as if I'm in it. Some even assume I'm a nurse. I'm nothing. I'm not. I'm in the retail industry. So someone also asked, please, I have over 3 years experience in health and care assistant from Europe and home, and I've applied to various places, but they aren't willing to offer COS. Well,
um, I think we've mentioned that
yeah.
we still need to keep trying,
Kind
because
of.
as you are trying as well, other people are. And the other thing that I need to mention that majority of people might not have mentioned this is that for every care organization they have a minimum or maximum of people that they can bring to the UK, because
Oh,
these
really?
people, yes, these people need to submit their financials for the year. They need to sub before they can get the because before they can get the sponsorship license, they need to submit the financial of the year. They need to submit the account through the accountant. They need to submit also the number of clients they are supporting. So, for example, if I only have 10 people in a care home, how do I prove to the government that I need 10 staffs?
Wow.
So they have the minimum of people that they can actually apply for. So, and we have to bear in mind also, especially if you are applying through a company owned by a black person, bear in
Yeah.
mind that this black person also has a sister.
Ethnicity.
The black person also has a cousin. They have friends and families that they're already calling them, Auntie, I know that you have a company in the UK. Are you going to try? So that's why you have to bear all of that in mind and then be patient and, and never stop trying. Never ever stop trying. Work on your
It,
CV. Sit down.
yeah.
I'm gonna share a tip with CV with you right now. What you can do with
Okay.
CV. You don't need to pay anyone for CV. If you find any job, this was what I learned from a recruitment manager, HR, human resources. If you find any job, go to their job description. Can I share my screen on here?
Um. Yeah. You can. You can. I don't know if. How do you want to do it?
Let me see if I just want to share something with you on what you need to on what you can do when you find jobs online, because
All
that this
right.
is and there are some jobs that sometimes they don't even go through the screening stage and you think they're not calling you. It's because some of them have put something on the system that it won't there are some keywords that they're looking for that you might
Oh,
not
wow.
even get through those keywords, and they will not
They'll
even
just
see
type it.
that. And if they can't see that, they can't even screen you because they haven't seen what you've
What?
written.
Wow.
So I'm going to share just one of them with you right now and see,
All right.
just as an example. Let me see if I can share my screen. Share screen. Can you see my screen?
No.
I'm trying. Just one moment, please. Okay. Can you see my screen now?
Okay. Let me add it. So. Okay. Yeah.
Okay. I'm just going to go here.
Okay.
Can you see the screen?
Yeah. We can see the
Okay.
screen.
So, for example, if you go on this organization and you're looking for a senior care worker role, you see
Okay.
where the location is and everything. At the moment, these people, they have not said that they are looking for international people. Let me see. Can you see this one? They are clear. They said for UK applicants only. For this
Yeah.
kind of organization now, don't even bother. They don't have the license. Don't even bother with them. It doesn't matter if you call them 20 times, they will not because they don't have the license. It's not every organization that have the license. But what I really
Yeah.
want to share with you about the what you can do with your CV is
CV.
that
Yeah.
if you look at the principal responsibility of a senior care worker, all you need to do is they said guiding and monitoring care and support workers. You need to put it on your CV that you have guided and mentored care support worker the way they've written it, because that is what they put there. That is what they will be looking for.
Really? Wow.
That is
I
that is
never
it.
knew
If
this.
everyone that said they want to do your CV for you, go and bring 20,000 naira. That is what they are doing. And for every CV, for every job that you find, don't use the same CV and be sending it over. Go to the job description of that particular job or that particular organization. Go and look at the responsibility. Most of the time the responsibility is similar, but the key words are not. So instead of saying guiding now, someone can say empowering and mentoring. It's different from guiding. This one, they've said guiding and mentoring care and support workers. The second one says collecting information and documentation from a client's home for updating documentation in office. You have to put it on your CV. As a senior care worker, you've collected information, you've documented from a client's home before, and you've updated documentation in office. Obviously, you will not lie. You need to make sure that you have this experience and you've actually done it. And if you
Yeah.
haven't done it, make sure you are in the process of doing it and learning the experience. So the same way, this is one tip I learned from a very senior recruitment person, and this is what he said. And this also goes for any job, not just a care job alone. For any job you want to do, try it. You can try without putting your location. See if they will not call you. They will
Wow.
honestly, they would call you immediately. And since I've learned all of these tips, I don't do it happened to me one time that I'm gonna stop sharing my screen.
Okay.
That I needed someone to look into my CV. I wanted to change my career at that point. I wanted to go into human resources, and I needed someone to look into my CV. And I was, they're telling me it's expensive in this country. Even 20,000 naira is cheap. It's expensive in this country because it's people's time. And even this lady, she was I just thought, what can I do? So I spoke to a friend that is already doing the job, and she gave me the tip. This is what you need to do. And when I did it, I had so many calls for interview, so many calls
Wow.
for interview. Yes, that's what you should do.
Learning. I'm
Obviously,
so happy.
It
Yeah.
takes time. So if you don't have the time, you can pay people to do it. But if you have the time, please do it yourself. Because as you're doing it as well, you're getting yourself familiar with the needs of that organization. So yeah, that's what I just wanted to
This
say.
is amazing. This is an amazing tip that nobody will share. To be honest, this is an amazing tip that no one will share. Even me, it's this is a learning life for me because I want to start looking for jobs soon, and this tip is going
Yes,
to help me. So thank you so much for sharing. Like you're just amazing. Not everyone will come on live and give you this secret because everyone just want to take money from you. Even when people message me like I'm willing to pay for consultation, I like I don't want to take your money. What if I take your money and you did not get the job? It's
that's
I don't
exactly
yeah.
that's
So because
exactly
it's tell you put you on the right path. I can't give you the job. I don't have the certificate of sponsorship, and I feel like you're in Nigeria. You need money than I do. Cause if you send me naira, I convert it to pounds. It's nothing, to be honest. So why do I need to charge? So I
Mhm.
try to do it just to help because it took us, me and my husband, it took us 2 years for us to get a job in the UK. We
Wow.
applied for job consistently for 2 years before we're able to get a yes.
Wow.
Here
And
we
that's
are,
what
like,
people are trying to get within 3 months.
and this is my husband has experience, so 5 years of experience working in a big four in Nigeria as an accountant.
Wow.
Big
Wow.
four, not just any accounting firm. 5 years of experience, and it took us 2 years to get a
Wow.
job. It's
Wow.
even a lot easier now, I feel like,
Mm.
than back in the day. So someone asked, I think okay. I have MVQ level 3 in health and social care from the UK with over 5 years experience. Can you help with recruiter currently in Nigeria? Wow.
Okay. Wow. He has health and social care in the UK. Is Are you currently in Nigeria?
Yeah.
Oluwatosin, I mean, he's in
Yeah.
Nigeria. Okay.
Yeah.
Um, the other thing I would like to share is this website, because if I say that I have a lot of people, and like you've said, a lot of people have come to me for consultation because I do training. Olivia said we skip
Yeah.
Israel question. Sure.
Sorry. Okay.
Um,
What is that question?
I'm
Um.
very skeptical of saying that, bring money for consultation or bring money. I do training, bring money for training and everything. I stopped. I said I'm not doing training. I am not, because at the end of the day, I don't want you to be expecting job at the end of the day. But I'm going to share this my screen again, if you can please allow me to do so. There is this
Yeah. If you
website.
quickly.
People might have seen it.
Sorry. If you can quickly answer Olivia's question because we might just
I
forget.
didn't see the question.
She said, my question would be that are there classification or categories in this care job? I have a master's in social work in healthcare, and I feel like my career my care assistant falls below my. Can you see the question?
I've seen it now. So I have a master's in social care work, healthcare, and I feel like yes, it falls below your qualification. Absolutely. So can everyone see my screen again?
Yeah, we can see your screen.
Okay. If you go on the if you go on this website, the government website, you will find a list of jobs that are under the shortage occupation, right? You find the list of jobs. I don't know if anyone has already gone there, but if you
Yeah,
haven't,
I have.
you
I
have.
sleep on that.
So for someone with a I can't remember the question again. Let me see. He said he has a master's in social work. For you, that you have a master's in social work, you need to go for the managerial jobs like this one, the health
Oh,
service and public health managers and directors. All of the jobs you can apply for that. And also this residential day domiciliary care managers, all of the jobs that is residential or domiciliary care managers, you can apply for that. So you have an edge already because you already have a master's in social work. So you
yeah.
don't need to apply. Don't if as a matter of fact, if you apply for care, they will not even answer you are overqualified. You're overqualified. And I'm sure Faith can share something with overqualification in this country. They will just tell
Yeah,
you you're overqualified and that's it. So
and
don't
you'll be
even
wondering
try.
why you're applying for the job. That's why I keep telling doctors in Nigeria wanting to come to the UK via the health and care. And I'm like, what is going on, guys? You guys should apply for more job that will pay you more.
Yeah,
Even though we were looking for jobs in the
doctors are,
UK,
yeah.
yeah, we weren't desperate. We were still looking for something that will pay more. My husband never settled for less.
Mm-hmm.
He wanted a job that would pay him more salary, and he got it.
Exactly, exactly. Don't try to go below what you already. If you don't have, obviously, if you're thinking of changing your career, but not like a doctor wanting to do care. So if you're like a business person and you're looking to come into health and social care, then obviously you can start from being a carer. But if you're already a doctor, doctor is also part of the shortage occupation, so you can actually apply for job straight away, and you can go on the NHS website. But what I actually wanted to, the other thing I wanted to share is this website. I don't know if anyone has seen this website.
Yeah, UK hired. Okay, UK sponsor.
Yeah.
Yeah, okay, yeah. That's a list of sponsorship.
So there's a list of organizations that have sponsorship. There are
Yeah.
some you can check the date. They've added them. Some people have added it since 2013. You know, I mentioned it that it didn't just start since last year. It has started a long time, but it started with the managerial admin office, accounting. Even within health and social care, they have an accountant at the office and things like that. But now they've added the care workers, so you can go on this website yourself. As you can see, so far there are over 283 organizations on the care alone. I put the care on the search button, and that's why you can see the care homes. If I change it, it will show you every other organization. Like social work now. If I put social work there, it will tell me the list of people that are looking for social work. Can you see? Other about 1,309 social work.
Wow.
1,309 social work.
That's
So
a lot.
it is a lot. It is. But like I said, once you click on this organization, remember what I said about the job description, word for word. But don't copy and paste it. Oh, if once they said that we want someone that know how to cook, you will tell them I have cooked for 20 people. You understand? That's how you do
Yeah.
it. So you're not going to copy that word for word. You're going to change it and personalize it. You're personalizing the words that you have. Obviously, if you have. I will stop
Yeah.
sharing the screen again. So, yeah, if you haven't worked for many years, start volunteering now. Start volunteering. Faith can tell you about volunteering in this country, and that's what
They
keeps this country
respect
moving.
it.
They
Wow. They
respect
respect
volunteering. I am still
volunteers.
volunteering. I
I
do
would
mentorship for Prince Trust
really.
charity. Yeah, I do mentoring for Prince Trust Charity. Is owned by the Mama Charlie. Is owned by Charlie Charles. So it's Trust Charity. I volunteer for them as a mentor because of my skills. So I still mentor, even if it's once a week. I spend my time an hour. So it gives you an edge. I have that on my LinkedIn page. And people see that, oh, you still mentor. Start mentoring. Those are the things that will give you an edge. Start mentoring in your community. Go to them, support them to serve. Even if you're just that's what you do in health and social care. You support them to have the bath, you support them to feed, you support them with the medication, you support them with chat, companionship, speaking to them. That's how, I'm talking about the senior care worker now. With the senior care worker, then you support with supervision, you support checking people. Those are the things on the job description. And you can do it. So if you don't have that many years of experience, start volunteering now. It's not too late. Start tomorrow. Let's start
Yeah.
tomorrow. Yeah.
Yeah. Can you answer some of the question? Like someone said, if Nigeria is on the red list and they are not willing to issue COS, is there still a point at all for this? That is, did you
So
see this?
Nigeria is on the red list for what?
So the WHO, that's the WHO, sort of put some African countries or some countries with that their health system is not so well, that they stop active recruitment from those countries. So that is to say, recruitment agency that are approved in the UK that follow the code of conduct cannot recruit Nigerians. But that doesn't stop. I made a video about it today clarifying this, that it doesn't stop you from applying for jobs in the UK. All this is the UK government approved recruitment agency cannot actively recruit from Nigeria because they are on the red list. They cannot be recruited by the UK government. So it's just a government thing. But other companies, you can apply directly with the company. That's what I said. Or you can use different recruitment agency that is not on the list because of they have to follow the code of conduct in the UK. I don't know if you understand me. So being on the red list
Is
does
that
not stop.
being on the red list or not, it doesn't stop you from applying. Just like Faith has said, it doesn't stop you from applying. If organization, because one of the things that they have with some countries like Philippines is that they recruit directly from the government. So the government sort of have like an agreement. Nigeria
Yeah.
government doesn't have that agreement with the UK, but that doesn't stop a UK organization recruiting someone from there.
Yeah. No, during the pandemic, a lot of the HWO, so a lot of doctors were moving out of Nigeria during that 2019, 2020. Omo UK packed Nigerian doctor. So we were not lacking doctors in Nigeria because nobody to attend, and most doctors are like leaving. So they sort of put I hold to that. So the HWO, that's who gave and like a rule that Western countries should not hire directly, like the government cannot hire and recruit health workers from all those countries that are still struggling with their health system. So, but it
Mm-hmm.
doesn't stop organization from
From
just that the government will not be part of it.
That's
That
what I'm
is,
saying. That with the Philippines, the government is part of it. The government has an agreement with the Philippine government,
yeah,
but the
same
government
as
does not
Kenya.
have. The government does not have can't have an agreement with the Nigerian government because our health system is not good, right? But it
Yeah,
doesn't stop. It doesn't stop you from applying from a private organization. For a
exactly.
private organization, it doesn't stop you. From the NHS, yes, because NHS is national health system, so it might stop you. But from the private organization, it doesn't stop you.
Yeah, because they have that the government of Kenya and Nigeria and UK, they have that treaty, so they can employ higher
Yes.
health workers from Kenya, but they don't have with
Mhm.
some other countries like a whole lot of, and South Africa is not even on the list. So on with South Africa, NHS can recruit directly from there.
From them,
Anybody can.
yes.
But
Mhm.
because Nigeria is in the red list, it's not, those government organization cannot recruit. So it'd be like they're breaching the rules that is there. So that's why it's good to just apply directly with the employer or use an agency
Mhm.
that is not government approved. Okay.
Yeah, I hope
So
that
yeah, I hope that answered your question. So I
someone
mean,
was
but what
asking
would
about volunteering. It depends on the job that you want to apply for. It depends on the
oh
job that you want to apply for. So what if I'm trying to apply for a care job now, because there's no care home in Nigeria, I would volunteer in my at my local clinic. You can volunteer there, say that you want to support them. So if it can be just 1 hour a day, or you can choose one day a week just to volunteer, or 2 hours after work, support them, relieve the doctors, relieve the nurses.
Nigeria is not like that though. The
Really?
volunteering is different. So because Nigeria, we're too entitled. I'm sorry, I was saying this here. So sometimes when you want to do something for them for free, they're entitled, and you can't just. Sometimes if you're coming like I want to volunteer maybe you walk to a hospital like I want to, they will not answer you. So you have to go like take a proper internship, like go to the hospital, tell them, okay, I want to learn how to be a health assistant, and
So
they will
you
ask you
can
to pay
you pay?
to get internship. Yes, you will pay because yeah,
So
except maybe you go to
you
the
can't
government
volunteer with them.
except you have to go through like an agency or something. But like walking to the
Wow.
hospital and telling them, oh, I want to volunteer, it's not something that is done a whole lot. So we're not used to that volunteering
Wow.
yet. The UK is more advanced, so they understand when you walk to a store, be like, oh, a charity organization, like I want to volunteer. They understand. But in the UK and in Nigeria, it's not like that. So most times, what I keep saying is go to a hospital, tell them you want to learn, like auxiliary nurse.
Mm-hmm.
They didn't
Wow.
study in school, so they just learn. So they watch, yeah, the watch nurses. So they learn it. They did not go to school. So auxiliary nurses, they paid to get trained.
Wow.
So I would say maybe if they can use charity organization, especially Red Cross, being the fact that it's global. Red Cross is in Nigeria, and I
Mm-hmm.
have a friend that volunteers for Red Cross, and she has been with them for a whole lot. Mimi, yes, I mean sorry, WHO.
WHI.
I don't know saying WHO. Yeah, WHO. Thank you so much. So yeah, NGOs as well. So, but Nigeria volunteering system, you can't just walk to a hospital and be like, I want to volunteer. They will just be like, it's sort of strange. So yeah,
Wow. But if you know any clinic, if it's a family clinic that you've been using, at least they can't say they don't know you. Obviously, they might want to get something from you anyway. So,
yeah,
I would, but if you know any clinic that you can speak to the doctors there, and if it's learning too, yeah, learning is very good. At least you have the experience as well, and also being
yeah.
able to, they will also sign you off, and
Nigeria
not
is
just
trying.
say,
They have some care homes, especially in Lagos. I've heard
yeah.
of like five. So they are building like care homes now in Nigeria. So it's
Mm,
also a good place for them to go and learn. I know of Ascent Care. I actually had the MD on one of my live. So she
good.
has a
Yeah.
care home. Yeah. So that's a place for them to learn as well. And she's trained in the US. So as a carer, so which is a good platform. We have some questions. Can you say the questions?
Can't see. So should I take a agency job? Which one is that? Does this
Uh,
being on the red list matter if you reside outside Nigeria and also furthered your study in your current location?
no, it doesn't matter.
Do you live outside Nigeria?
I think so.
Yeah. Olivix, are currently outside Nigeria? The red list doesn't matter if you have one thing you need is if you have a sponsorship license, the certificate, right? They can't say for private organization not to recruit from Nigeria. I don't know about like medical roles like doctors and things, but for carers, they're in need of carers. So they will not stop any organization that already have the license as long as they can prove that you have all the experiences to come and work here. So they will not stop them from giving you the visa. Obviously, it all depends on the consular as
It's an
well, but
individual. Yeah.
Is that the organization is not owned by the government. It's only government owned organizations that might affect. But for private owned, and most the care agency that privately owned, that
Yeah.
privately owned by individuals, is not owned by the government, right? So once you have the sponsorship license, the only thing that you need is a sponsorship license. So once you have that, every other thing sort of fall in place.
Yeah. Exactly.
And Emma Dion, you can add that to your CV that you already, you already have this experience. Yes. So start volunteering, and also take the caregiver course that you have online. You can add it to your CV that you're volunteering with this organization. Obviously, with that organization, they can ask them for reference. So let them know.
Yeah.
Wow.
I told you,
Yeah,
Julian.
Juliana, she went to a hospital and the doctor said no, no, no.
I
Wow.
don't want to be involved. I told you, like, it's going to be like you're coming to do something fishy. You know,
Wow. The main thing is like witch or something. Oh my goodness.
Nigeria, you can't volunteer. Like, they'll be like, you're coming to do something fishy or you're coming to harm their patient or something. Like, you
Wow.
can't just, you have to properly go through the proper way, which you have to pay money for.
So do you know how long it takes in Nigeria for the auxiliary nurses? I don't know.
I think it's a year or 2 years because they just want to keep you longer. It's something you can get in within 6 months, but they'll tell you after your course in 6 months, you have to intern for 6 months again or something. So it's like a year and a half. I'm not sure though, but I know it's longer.
Hmm. It should be. Betty Lee said that would you accept agency or turn it down for volunteering? Agency, is it for in Nigeria or here? If you have an agency job, is fine. Absolutely. Accept the job if it's an experience that you need. But if you
Yeah,
don't get the job, you can accept volunteering. Bettilia said that you have a degree in maths, communication, and 2 years experience in auxiliary nurse, and you're already told you're working with an NGO. You do stand a chance, absolutely. But
you do.
you just need to emphasize more on that auxiliary nurse rather than the mass communication, because the mass communication is not relevant to them at that moment in time. So you just need to emphasize more on that. Ascent Care refused my offer to volunteer with her because I'm sure Ascent Care is receiving a lot of offers. So she might not even have the space for more volunteers again.
Exactly. Exactly.
I
Okay.
reside in Hungary and studied for my master's here. What was it? Olivix I studied for social work.
Yeah, I think she's the one. She's the one that asked if she's not in Nigeria, if the red listing count. So as long as you're not in Nigeria, and yeah,
Social work, you can apply to agencies. As a matter of fact, they have agencies that, with social work, you can apply to agencies. And also, I showed some organization that are also looking for social workers. So you don't have to go through the government to apply for job. So you shouldn't be affected by it. You shouldn't be
yeah.
affected by it. Would you accept what I think there's some other questions. Okay, supposed to be done to grandma.
As Julian asks if
You would add that everything that you've done. I was speaking to a lady and she said that I have had this experience with a family member that had stroke. You had at your CV. Go and check all the stroke, all the people, all the care needs for a stroke person. Add that to it. You support them with shower, you support them with medication, you support them with feeding, you know, add that to your CV. You can add that to your CV.
say
A pharmacist shouldn't apply for a care job. Go and
I
apply for
do.
a pharmacist job.
Oh my goodness,
Don't
don't
apply for a care job.
you're sort of bringing yourself down. You can get though before you can become a pharmacist in the UK, you have to qualify. I guess it's the process you're trying to skip because
Yeah,
the process is long. So some of them just want to skip that exam, getting UK qualification, and being is it qualified to practice in the UK. So that's why they want to use the care route and
yeah.
move. So I understand. Yes, you can apply for a care job. I think
You
since
can
you
still
have
apply
knowledge.
for a care job. You can still apply for a care job, but you can also apply for a pharmacist job. And it doesn't stop you from having two CV. They're not going to tell each other. I'm telling you, they're not going to tell one another. Data protection in this country, no organization can share your details with the other person. They don't have any business with that. So you can have two CV, apply for this, apply for that. Whichever that
Yeah.
comes.
Yeah.
And now the
Okay. Yeah.
process is long. It is long. It is long.
Yeah. I see.
The
Okay. Is
website I mentioned was UK tier, like TIER sponsors.co.uk. There are a list
funds.
of organizations that have sponsorship there. And it includes science, anyone, just name it. Different organization, even for religious bodies.
Okay. So let's go back to our talk. We'll come back to the questions later. So I don't know. Well, share your experience with me working in health and care in the UK. What would you advise people back home who are applying for this job in the UK? Like, what should they expect? How should they prepare themselves? And even down to the job interview or applying for the job, you already gave them tip on what to do on their CV, which will enhance their chances of getting a job. Then, if they get the job during the interview, what are the right things to say and all of those?
Okay. So once you've applied for the job, God has done it, you've been invited for an interview, you need to know your CV inside out. So know what you've written on your CV inside out, because they will be
Okay.
asking you questions that's related to that. The other question they want to ask you is, tell us about how you've done supervision. So you said you've done supervision before, or you've managed someone before, you've carried out care assessment. So how would you carry out a care assessment? How are you able to identify some of the senior care role does not require you to do a care assessment? That's why you have to check the job description and be very sure of the needs of that organization. So but once you're sure, they will ask you to, okay, tell me about yourself. That's the first question they ask you in this country. Tell me about yourself. What do you know? Read about that organization that you've applied to. Read very well, read about what they do, read about the history, that sort of make them happy. Read about the history, read about what they do, and then be prepared to have like a 2-minute pitch about yourself. My name is so I've had this experience. Just with the first 2 minutes, give them everything, that even the interviewer will be shocked, and then unable to ask another question. But the other question they would ask you after you've introduced yourself, the other question they will ask you is, what do you know about the organization? Okay, can you tell me, what is dignity? How can you dignify a client for a care role now? That's one of the things that they ask. What is dignity? What do you think someone that is receiving care is entitled to? So you want to mention things like respect. You want to mention things like privacy. You want to mention things like care. You want to mention things like dignity. So those are those things that they would ask you at the interview. What are they entitled to? And so they might ask some scenario questions. Can you tell me where you've worked as a team? Teamwork make the dream work. um, One of the C6 is called the values of health and social care. One of them is partnership. We have to be able to work as partners, and one of the person-centered care is partnership. We have to be able to work as a partner, and they value team working alone. So they can ask you questions like, "Tell me about a time you've worked as a team." So just mention that too, when you've worked as a team, what you did, what you contributed. So don't keep talking about the people, someone that about yourself, what you contributed, and how you also gave other people chances. So those are the things that they will be looking out for when
The
you go for
UK is
interview.
talking about teamwork. Like, I
It is.
even any interview at all, the first thing they will ask you is like I mean, after they've asked you a personal question, is teamwork. How have you been able to work as a team to achieve a
Yes.
goal? Like, you always put the teamwork first. The scenario question also is there, even if you've
Yes.
not had the experience, or maybe the scenario question is not something you've experienced before, just try to create one in your head. Imagine, that's all what I always do. When they ask me, because I like, you guys, I don't know, but I'll be like, I remember I would just create a story. You need to be a good storyteller. I'll just create a story in my head. I'm like, okay, I'll just tell a story that was I never experienced. It's something that was not I was not there. It's a story I created. You know, you have to be like a writer. I tell them the story they want to hear. So sometimes,
Mhm.
because if you know you can do this job, they just keep asking you questions. I'm like, so somehow they just want to know you are a team player. You can do well with your colleagues, and so that's all. We
So
have a lot
that's
of
all.
questions.
The other thing that would also help is, yeah, thank you so much, Faith. That's absolutely right. The other thing that will also help you is you need to get driver's license. I know majority of people haven't mentioned that. You need to get a driver's license. It will also help you. It might not help. It depends. It will help you if you're looking for a domiciliary care job, because with the domiciliary care job, so there are different roles within health and social care. You see, there are domiciliary care, there are support workers, there are people working in a care home. So the domiciliary care people are the people that drive from place to people's home to take care of them. There are people in
Oh,
a care home that all the hours is fulfilled in a one care home. Domiciliary care, you go from home to home. So if you are, for example, if you have a driver's license, a lot of domiciliary care agencies that have a sponsorship license, they would give you the job than someone that doesn't have the license, because it's needed, because it will make sure that you do a lot of hours. So driver's license too is a good idea to get.
and
um
Nigerian driver's license is actually valid. You can use it for the first
for a
1 year,
year.
but you need the
Yeah,
international driver's license from Nigeria. So if you're coming to the
yes.
UK, there's an international driver's license you can use here in the UK that is from
In the
Nigeria. You
UK
can use
you
it
can use that for a
for,
year. Yeah.
for a year, and after that, you can then switch. So we have some questions here. Wow, a lot of questions.
I'm so sorry, but I will need to go in 5 minutes.
Yeah, no worries. Thank you. So I'll just be here. So you can just answer like two of their questions and then you can go. It's really an amazing time with you.
Thank you
So
so much. So some doctors are afraid that if you get volunteer job, the nurses will get to know. Oh, and I don't want the nurses to leave. I can feel them, honestly. Um, and you know what that means. They might want to move like me. It's kind of veterinarian doctor. Yeah, medicine from Nigeria with 6 years working experience, social care works and psycho. Okay. Yes, you
veterinary.
can. You can. Yes, absolutely, you can. But obviously, any job that you apply for, it has to be related to your experience. So whatever
Yeah.
job you apply for, it has
Vet.
to be related to your experience. Okay.
Yeah. So yeah, a vet. So it has to be with relating to vets, I think. Um
Toluwala Share needs to call me. So if you're already in the UK, if you're already in the UK, you're a student in the UK and you're looking to change into work permit, it's easier. So if you're a student in the UK, you need to follow Black Women in Care or just send me an email. Support info at blackwomeninCare.com.
Let me put it
So
here.
I can see Toluwala shares message. Is it was it a question that you're already in the UK, you have a 20 work permit, so you're already doing your masters. So masters, I know that is a year. Also, with your masters, you have 2 years of grace to work. So I don't know if you've already done that.
So what's the email address again? Let me type it in.
Info
Info at Black Women in Care.
at blackwomeninCare.com.
.com. Okay. So we skipped what's his name?
Yeah, if you
Forget.
got your MBQ from UK, yes, you can apply. You can apply from Nigeria. You can apply for a senior care role in Nigeria, but don't rely on your MVQ alone. Also, get the experience, please. Get the
Okay.
experience. Pray that you get the
Ogbenet
experience.
has said, can COS be issued before 15th of February for applicants in Nigeria? Yes, yes, it can. It can. So
Yes.
because some company already have the COS before the care visa thing
Uh
came
huh.
out. Some companies already have the COS. So you can go check. I already put the link. You can go check the website to know the care companies that have the certificate of sponsorship COS. So yeah. You didn't answer my previous question. Got NVQ level 3 from UK, but I'm in Nigeria right now. So he already have NVQ. So you have like an added advantage. NVQ level 3 is still recognized in the UK, right? Yeah.
NVQ level 3 is very much recognized. That's national vocational qualification. But hold on, is it on in health and social care? If it's in health and social care, absolutely you can apply for a job from Nigeria.
Okay. Okay.
Accounting, for someone that is an accountant, Amechi said, is I'm an accountant. You work as you can apply for an accounting job.
Yeah. Actually,
Unless
you
you want to change your course, you want to change your career rather, and then that's when you start from a senior. You know that will be uh in the UK. Oh wow, yes, please, you can. That's even great. So you can, unless of course you don't have any issues with immigration before, so there shouldn't be any reason. You can apply with those with that organization that I've mentioned. Go to tier 2 sponsor.co.uk. You see list of organization there that you can apply with. And just like someone mentioned with Ascent as well, these people, they don't know you too, and they get a lot of this application every time. And like I said, also they have a minimum of people, maximum of people that they can bring to the country because of the financial state, because of the number of service users that they have. Service user is what we call the people that we take care of, we
okay.
support. So you have to bear that in mind. And like Faith has mentioned, be patient. It took and our husband 2 years, so be patient.
Yeah. All right. Thank you so much. Do you have any final words for all of us? We
Uh,
in Nigeria, in the UK. So maybe like something advice, something they can go home with and prepare themselves. So maybe a final
um,
word.
Final word from me. I would say that there's nothing impossible. So there's nothing impossible, and if it's God's will, I don't know if that's what I'm looking for, but I know that if it's God's will, it will come to pass. It is possible, to come into this country. And you mentioned something earlier that preparing them coming to this country, don't is coming to this country is not just the end. As a matter of fact, it's the beginning. It's the beginning. When you come to this country and you're thinking of how you need to renew, but the first step is coming from Nigeria. So I would say that it is possible. You can do it. Be patient with yourself, and don't say because you're trying to come to the UK and you sort of leave everything, on pause. Keep
Doing.
going with your job. Keep going with whatever you're doing right now, and with anything you might be doing right now, do it with all your diligence. I tell you, you would need it. Do whatever you're doing now with all your diligence, with all your might, with all your heart. And then I'm telling you, at the end of the day, you will be glad you did. And keep praying. It is possible. And
Yeah, it is. So just keep enhancing your knowledge, your experience, and yeah. Ngozi, early teacher study guidance counseling. What are my chances?
I think some
Um,
teachers at one point, there were teachers on the skilled workers
yeah,
as
they're
well.
still on the list, but the process of becoming a teacher in the UK is
Mm.
tedious. You have to get QTS, blah blah blah. The process is long. Again, Nigeria is not on the list because our educational system is still backward. Like
And
so,
people are
I'm
trying
sorry.
to come here to
This
teach.
company, Nigeria is the government that is stressing you guys because other visa type that other country benefits from Nigeria cannot because we are still backward. Our educational curriculum is still old school. People have
It's the
advanced.
old
The UK has
school,
advanced.
honestly.
Yes, the
Honestly,
UK is more practical, and Nigeria is still doing theory. Like so,
it's story, and that's why people feel like they're failing. But not that there's no one. You get to this country, you understand what they're teaching you, and you be like, I actually know book. Like I'm
yeah,
brilliant. It's Nigeria that makes you feel like you're not brilliant. You are.
yeah,
You think about because I did teaching training here in this country because I'm a trainer, and what it made us realize is that there are different types of learners. So they have different categories put together. Some people are visual learners. So in Nigeria, they'll keep teaching you on the board doing this. While some people they're sitting in the background, they're not visual learners. They need to do the practical side to put their hands into things. I know that Nigeria will get there. I know that Nigeria will get there, but don't stop reading. Read wide, and the internet is there. The YouTube, I'm sure Faith has a lot and lots of information because I've been on her page as well. And I've seen a lot. Some of the questions you've asked here, she already has it on her file. So just go on our YouTube, check as many as possible. That's another way to learn, enhance your skills, enhance your
Knowledge
skills. And
is
once you get
power.
there, empower
Yeah.
someone to like she's doing it for free. Like time is money in this country. We get paid per hour, but look at her, she's sitting there doing it for free. So once you get there too, empower someone, take someone with you, pay it forward as well. So thank you
Thank you
so
so much,
much.
guys. Good to have you here. And I can't wait to join Black Women in Care, even though I'm not in care. I'm coming.
You will join us. What course
I'm
did you study?
English, English
You did
language.
English. You can still join us.
How can you say? I will just come and watch and hear you guys share your experience. Who knows? Maybe tomorrow in the future I might be in care. So you never
Yeah.
can tell. I can just change my mind and be like, you know what, I don't want to. I want to go into care now. Thank
Yeah,
you
but whatever
so
role you're
much.
looking into get, if you're doing teaching, you can do the level 3 in teaching and training.
I don't like
And
teaching. Honest.
uh,
I'm actually thinking of something to study because I want to go into social media. I think I have
okay.
passion for social media, and also I'm thinking of getting trained in social media and be like a social media marketing manager or something. So yeah,
Oh,
thank
that's
you so
good. That's
much.
good. I think you'll be brilliant at
I
it.
learned a lot from you today. Like it's not just the people back home you're teaching me as well. So if I have any question in the UK, I'm coming to your DM. Hope you're ready
I'll
for
be
me.
happy to support.
Thank you so much. You've been an amazing. So I'll share your handle if you don't mind, your Black Women in
That's
Care
fine.
Instagram handle, so that people can go follow you and bombard you with questions. Because I had to turn off my DM because it was overwhelming.
I
So
know, I know. The people, yeah, it is a lot of questions. Yeah, it is a lot. But they don't need to disturb you now. Please go to our YouTube page and watch and
you
share.
don't want to watch on
Share,
YouTube.
share,
It's
share
fun.
the page.